Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to deal with a very interesting topic that is known as the therapeutic communication. So what is this? This therapeutic communication is the communication between the healthcare professional and the patient for the purpose of creating a beneficial outcome for the client. So this is a face-to-face process of interaction in which the nurse or the healthcare professionals and the patient will be having a conversation. The main focus of this interaction is to advance the physical as well as the emotional well-being of the client. The nurse, will use this therapeutic communication in order to provide education as well as support to the patient, however, maintaining the professional distance as well as the objectivity. So this is what therapeutic communication is. It is a communication between the healthcare professional and the patient for the purpose of creating a beneficial outcome for the client. In this, the client will be the main focus of the interaction, and it is also meant in order to advance the physical as well as the emotional well-being of the client. So now moving on to the principles of therapeutic communication. The first one is to plan an interview at an appropriate time. So here, before you initiate this therapeutic communication, you should make sure that, you start it at an appropriate time. You implement it in an appropriate time. Why? Because here, if, the patient is not in a good state of mind, to have a conversation, or if he is suffering through pain, then this communication will not be effective. That's why before you initiate this therapeutic communication, you should make sure that you do it at an appropriate time. The next is to ensure privacy. So whenever you communicate with the client, whereby you need to gather the information of the client, you need to make sure that privacy is being maintained, so that if there is privacy, then only there will be confidentiality. Then the next is ensure the guidelines for therapeutic communication. So before you start this therapeutic communication, the guidelines which you should follow during this therapeutic communication must be kept in mind. This therapeutic communication is only meant to last as long as the patient stays in the hospital, and it must be terminated before the patient leaves the hospital, because this communication is only meant to last until the patient leaves the hospital. So before you establish this therapeutic communication, you should make sure that the guidelines have already been established. The next is to provide comfort during the communication. So here, while you will be having this communication, while you will be interacting with the client, you should make sure that the client will be comfortable. You should create an environment which will be comfortable for them, and you should create an environment whereby they will be able to trust you, so that they will self-disclose themselves. And through this, you will also get many information which you may require and which will help you to follow the nursing process. And the next one is to accept the client exactly as he is. Here it is very important that as a nurse, you should not discriminate anyone, nor you should judge them. Here, when you are initiating this conversation, when you are communicating with the client, it is very important that you should accept the client as he is. You should not judge the client, or you should not discriminate them. Whenever you have a conversation or whenever you are communicating, you must encourage the spontaneity. Not only that, but as I've said, that this therapeutic communication is a communication whereby the client will be the main focus, right? So whenever you are communicating, you should make sure that the client will be the main focus in this, and you should also focus on the leads and clues which is presented by the client. While having a conversation, you should also try to encourage the client to express their feelings, their thoughts, their ideas, as well as you as a nurse must be aware of your own feelings. It is good when you empathize the client, when you try to understand them. However, you should know your boundary, as well as you should have a control of your own feelings during this interaction. So these are the various purposes of the therapeutic communication. Now moving on to the techniques of how to initiate this therapeutic communication. Here you can initiate this therapeutic communication both verbally or non-verbally. That means you can do it through words, or even through your actions, or your body language, or your facial expression. Now here, The first technique of therapeutic communication is offering self. So here, being a nurse, you must make sure that whenever you approach the patient, they should feel that, you are willing to help them, you are paying attention to them, you are showing your interest also in knowing their, feelings and emotions. You should also make sure that, you make them feel that, you are available for them both physically as well as emotionally. They must also get this feeling that you are willing as well as ready to help them at any point of time. And moving on to the second one, that is the broad opening. So as a nurse, you must make sure that you allow the patient to choose a topic for discussion. In this way, if you allow them to do so, they may talk about the things which it's there inside them. You will get to know about their thoughts, their feelings, and you should also exhibit respect for their thoughts and feelings. You should not discriminate them, nor you should judge them. And also here, you should emphasize on the importance of the client needs. So now here in this broad opening, as I've said, that you will be allowing the patient to choose a topic for discussion. Let them say or let them talk about anything they want to. In this way, you will get an idea of all the thoughts and feelings which they have inside, and through this you can also correct them in case if they have any misinterpretation of the message or any wrong idea about any particular thing. Here you should also emphasize on the need of the client. Now moving on to the third one, that is silence. So in order to maintain a good therapeutic relationship, it is not important that you must only talk, but it is also very important that you must listen to them. Here through this silence, you will be able to listen to the client, and by doing this, they'll be more interested to talk to you about their inner emotions and feelings, because they feel that you are listening to them as well as you are showing that interest to get to know them well. And through this, you can also exhibit your respect for the client thoughts and ideas. You should allow them to reflect on themselves, but you should also try to understand the message of the client. Here, it is not important that you must only sit and listen. Here, it is also very important that you should sit and maintain eye contact while you're listening to whatever message they are conveying. It is also very important for you to make an observation of their behavior. Here, suppose now if you sit there, if you're silent, if the client is talking but you're looking here and there, you're busy in your phone, or maybe, looking at the time, this, that, they will get an idea that maybe you don't want to listen to them, or you are forcefully sitting there. So this will not be effective. But if you are maintaining eye contact, you're showing that you have that interest, you're also observing the behavior, then only you will be able to get a clear idea of their feelings as well as their emotions. The next one is the open-ended question. So here, as a nurse, it is sometimes important that you ask questions which will not be answered in just one or two words, because in this way you will also get to know their thoughts, their feelings, their emotions more. So instead of asking, that where is your pain, you can ask how is your pain. In this manner, the person or the client will be answering in such a way that it'll not be just in one or two words. If you ask them where is your pain, they might just tell here. But if you ask them how is the pain, they may say that, oh, I'm having pain here, it's radiating from this part to this part, or nighttime it pains more, this, that. So through this manner, you will get to know more about the client. And you can also ask questions such as, tell me about your family members, rather than saying how many members are there in your family. Because if you ask how many members are there in your family, he may simply say four. But if you ask, tell me about your family members, he may say, there are four members in my family, me, my wife, my daughter, as well as my son. So the next one here is reflection, which means repeating the client words. So as a nurse, it is very important that you must reflect on the words or the important decision that the client has chose to make. So here, when you focus on the client message, on their ideas, on their feelings, they will get an idea that you are actively listening to them. So this can also be beneficial, because if they get that idea that you are interested, you are listening, they will be sharing with you more. For example, if the client had said, do you think I should tell the doctor that I'm a drug abuse? What you should say is, instead of saying yes or no, you can say, what do you think about that? So in this way, the client will get an idea that you are listening to them attentively, as well as you are trying to help them out. The next one here is restating. Here, restating is also similar to reflection. So what will happen here in restating is that you will be repeating or paraphrasing the client main idea. Through this, they will also get an idea that you are listening to them attentively, and you will also give an opportunity for the client to explain whatever they're trying to communicate to you in detail. The next technique here is exploring. So as a nurse, it is very important that you must try to find each and every information in detail, be it about the client, be it about their treatment, or even about the procedures which you need to perform for the client. So here, for example, instead of asking how do you feel the treatment is, you can ask, tell me about how do you feel after taking the medicine. So in this way, you will get to know whether the client is satisfied with the treatment which he's being provided, whether he feels that this is helping him or not. The next one here is recognition. So as a nurse, it is very important that you must recognize each and every behavior of the client. You must also point out the observed clues to the client. So for example, whenever her daughters come and visit her, you see that she's happy. So you can tell the client that I noticed that you become happy whenever your daughter comes to see you. So in this way, the client will also get an idea that you are not only there to provide treatment to them, but you are also there to focus on their emotional well-being. The next one is the directing. So as a nurse, you will be using this in order to collect the assessment data of the patient. So as soon as the patient comes to the hospital, you will be the one who will be collecting their detailed history. So this detailed history must be collected in order to help the healthcare professionals to plan for their further treatment and not to satisfy your curiosity. Here, for example, if the patient says that they told me I need to consult a counselor. So as a nurse, you can ask, where were you when they told? How do you feel about consulting a counselor? So in this way, you will get a clear idea of what are his thoughts as well as feelings. The next technique is making observations. So as I've repeatedly said, in my previous session, that as a nurse, we must always observe the client. We must observe their behavior. We must observe the way they speak, the way they eat, through this way, we will get a clear idea of the patient. So for example, you can say that you seem angry today. You seem like you are in pain today. So through this, you will, get a clear idea of the patient thoughts and feelings, and also the patient will be having an idea that you are observing them. The next technique is clarifying. So here, as a nurse, you must make sure that whenever there's any doubt, instead of misinterpreting the message, you should always clarify your thoughts, your feelings, or your doubts in order to get a clear understanding of what the client is talking to you about. So here, for example, if the client says that whenever I talk to my doctor, I feel upset. So he can feel upset maybe because he's scared of the doctor, or maybe because he is scared of whenever he comes, he gives medications, he tells him about his disease condition. So it may be because of various reasons, right? So as a nurse, when he tells you that whenever he sees a doctor, he's upset, you should not just assume things by yourself, but you can clarify it by saying, what do you mean by upset? So in this way, if you question the client, then the client will be answering and you will get a clear idea of what their thoughts are. The next one here is confronting. So here, as a nurse, if the patient is telling you that, oh, I am happy today but look sad, or if they say that, no, I am not in pain today, I can walk, but then he could not walk. So you can confront the client so that the client will get an idea, that you are supervising them, you are observing them. So here, for example, if a client say, I am happy today, what you can say is, you say you are happy, but you look sad. So in this way, the client will get an idea that you are constantly supervising and observing them. And the last one here is to limit the settings. So before you initiate this therapeutic communication, as I've said in the beginning, you must make sure that this should be initiated only when the patient is in the hospital and should terminate it until they leave the hospital. You should not carry this further. So before you even start the conversation, before you even start this communication, you should make sure that you have established all the guidelines in mind, so that you will be able to maintain that distance, as well as for the patient not to misinterpret whatever you are doing for them. So these are the various techniques of therapeutic communication. Now moving on to the next one, that is the obstacle of therapeutic communication. Certain obstacle can occur in the client and the nurse relationship that can affect the nature of communication. This obstacle can be because of the lack of knowledge of the patient, or because of their pathology, or it can also be from the nurse side, whereby she will not be able to make this therapeutic communication effective because of the lack of experience, or because of the lack of knowledge or personal problems. Here there are four key therapeutic obstacles in this therapeutic communication. The first one is the resistance, the second is the transference, the third is the counter transference, and the fourth is the boundary violation. Resistance. So here from the name itself, we can understand that it means lack of awareness or not wanting to talk about it. So here what happens is that resistance occurs in client who consciously or unconsciously maintain a lack of awareness about the problem in order to prevent anxiety. So if a client chose to remain unconscious about the problems, or if the client choose to become unaware of the problem in order to prevent anxiety, what a nurse can do is she can pinpoint the strength as well as the progress, so that the client will be willing to talk about it. Now the next one here is the transference. This transference is the unconscious response whereby the client associate the nurse with their significant others in their life. So what happens if the client associate this nurse with their someone significant in their life is their feelings and attitude towards the nurse will also change. So for example, a male client sees a female nurse as a mother figure because of their resemblance in their mannerism. So what can happen is that if this client had already had a hard feelings towards his mother, or if he has some problems toward his mother, on seeing this nurse as his mother, his feelings and attitude can also change. So he may take out his anger, he may take out his frustration, or he may also become angry or bothered by the nurse interaction to him because of this resemblance. So if any patient, behaves very awkward with you, you must try to get an idea why is he doing so. And after, you have understood that he's doing this because, he's been assuming you as someone else, and have been directing his feelings and attitude to you in the way that he will be doing it to the other person, then as a nurse you must try to use the therapeutic technique of reflecting as well as clarifying to begin problem solving. The next one here is the counter transference. So in transference, as we've seen that the patient or the client is the one who is not involving himself in this treatment process, who is directing his feelings and attitude to the nurse because she resembles someone else. So through this way, this communication will not be effective. And in this counter transference, what happens is that sometimes, as a nurse, you will be facing with different kinds of client. Some of them will be very honest, very humble, whereas some of them will be very aggressive and very violent. So for example, if you have encountered any client who was very aggressive, who was violent with you at any point of time, and you as a nurse, if you maintain grudges, if you keep hard feelings, then you will not want to approach the client, you will not want to provide treatment to the client. Then this can also lead to a barrier in the therapeutic communication. Why? Because if you don't feel like approaching the client, then you will not even feel like talking to him, and this will not make communication effective. The next one is the boundary violation. So here it occurs when the nurse goes beyond the established therapeutic communication standards and enters into the social as well as the personal relationship. So as I've said that this therapeutic communication is only meant to last until the patient leaves the hospital. So if she still continues this outside of the hospital, and if she enters into any personal or social relationship with the client, then this is known as the violation of the boundaries. This can also occur when you accept any gifts from the client, or when you begin to treat them at odd hours, or even when you self-disclose yourself more than required, then this is also one of the obstacles of the therapeutic communication. Now, moving on to the ineffective response that can hinder this therapeutic communication. So, this therapeutic communication, as I've said, is meant to last. There are various techniques, where you can communicate with the client. However, there are certain obstacles, and also there are certain responses, that will hinder this therapeutic communication. The first one is offering false reassurance. So here, as a nurse, as I've said, that you must always be honest. You must not make any fake promises or promises that cannot happen. In case if you do so, in case if you lie, in case if you make promises that there is no possibility for it to happen, then this can break the trust of the client as well as the family members. The second one is not listening. As a nurse, you must always be an active listener. You must listen to each and every concerns, or to each and every request, or to the thoughts and feelings which the client is trying to share to you. So if you don't listen to them, then this can also hinder the therapeutic communication. The next one here is minimizing the problem. So as a nurse, when you approach the patient, when they tell you their concern, their problems, instead of taking that into consideration, if you are trying to just minimize the problem in order to end the conversation, then this can also hinder the therapeutic communication. For example, if the patient is telling you that he can't sleep at night, he's having pain, he's having difficulty in breathing, so instead of you telling them that, okay, we will be doing this, we will be doing that, we can try this out, instead of you saying these, if you say that, yeah, it's very common that you'll be having difficulty in sleeping because you're having pain, or it's common that you'll be having breathing problem because you are going through this condition, then this can hinder the therapeutic communication. The next one is offering advice. So here, as a nurse, if you keep on giving advice to the patient, then they can get irritated, and this can also hinder the therapeutic communication. Then giving literal response. So here, if the client is telling something to you, sometimes they may say out of the bloom, just because they're bored, they're tired, they may say something rubbish, and if you also give back a rubbish response, then this can also hinder the therapeutic communication. For example, if the client says, the television is talking to me, instead of you saying, no, this is not possible, maybe it's because of this, maybe it's because of that, if you say, what is the television telling to you, then this can also hinder the therapeutic communication. The next one is changing the subject. Also, as a nurse, if you keep on changing the subject, if the client is talking to you about something else, and you just leave that conversation and you move on to another topic, then this can also hinder this communication. The next one here is belittling. So here, even when you try to discriminate the patient, or if you try to put them down, then this can also hinder the therapeutic communication. If also you disagree with the client many times, now here, if the client is saying something to you, if they are giving you their thoughts, opinions, and you keep on disagreeing with everything they talk about, then they will not want to talk to you about it anymore. Even if you judge the client, suppose now, if they tell you something and you say, no, you can't be like this, no, sometimes you will get angry for no reason, or if you say that whenever we try to talk to you, you're not listening, this, that, then this can also lead to ineffective communication. And also, if you try to challenge or if you criticize the client, then this can also lead to an ineffective therapeutic communication. So these are the various things that you should keep in mind whenever you are having a communication with the client. These are the various things that you should not do, because this will hinder the therapeutic communication. So now here we have come to the end of this topic. So in today's session, we have discussed about the therapeutic communication. What are the various principles of therapeutic communication? What are the techniques that you can apply in order to maintain this therapeutic communication? What are the various challenges, the obstacles that can occur in this therapeutic communication, as well as what are the ineffective response that can hinder this particular communication? So as a nurse, you must always keep these things in mind in order to have a good as well as an effective communication with the client. So I hope you guys have got a clear insight of this topic. Thank you.